Good, good afternoon or good morning or wherever you're at, whatever time zone you're in. Welcome to the Data Stories webinar series that covers many topics related to oral health data and has been developed as a learning opportunity for open organizations and members to find and successfully use data to inform efforts in advancing oral health equity. The Data Network response team at Open recognized that our members have a wide range of content expertise and want to learn more about using data in their local context. In response to that need, the Data Story series was created to share innovations and solutions that are happening around the country that can help us to realize our collective vision more effectively and efficiently. We are excited to share this resource and look forward to an open and engaging dialogue that will continue after these stories are presented. Well, today we have, and we are honored to have Beth Earnhardt, who is retired president from Senior Charity Care Foundation. Beth will present on data measurement in mobile dental direct services. Data stories making a difference in the lives of seniors. We were just sharing some really pertinent information about what happens when there's not enough coverage or no coverage for seniors. Thank you for joining us. Beth, take it away.
Thank you. So I have my presentation is going to be talking about amplifying consumer voices and bringing care to the people. Our mission at Senior Charity Care Foundation is to improve the quality of life for our elders in need. These are some of the seniors we've served. We were founded in April of 2011, and we serve seniors who are living in care facilities, assisted living, and senior apartments. And we first started these services and went into mobile shortly thereafter when I started serving people and working with private dentist's office and other nonprofits, and found that it would cost us like $5,000 to take care of one person's mouth. And so in a short bit, we're like, this would take everything that we had in a short bit of time. So in 2014, I applied for a state of Utah Department of Health primary care grant. And we started in 2015 with working with the Family Dental Plan, which was a state agency. And in a short bit of time on that, we realized that it was going to be serving less and less people because every year their prices went up 5%. So by July of 2017, we were providing the dental clinics ourselves, starting with a bare bones group of just me, helping to recruit the seniors to come to the clinics, as I had been doing with the Family Dental Plan, and then having our equipment and supplies and our dentist, and we brought on a hygienist that would help us as well. And now we've gotten to where that hygienist that we first hired is now the dental clinic director. And we have a couple of dentists, although we need to have a full-time dentist, and that's what I was working on before I retired. And we have a hygienist who does the services of hygiene, and an assistant that comes with the dentist. And it seems to be going fairly well. We are not quite back up to our pre-pandemic level, though. But this is our service area, which is 7 counties in northern Utah. We actually are working down in Washington County as well, down in the far corner, providing services, oral health care services for veterans, but it's not in the mobile clinic kind of way. And just to give you a little bit of demographics about Utah and our service area, in our service area, 20% are adults aged 55 and older, and 8% in the 7 county area live below 200% of federal poverty level. And for us, it's 80% of the 55 plus of Utah population resides in our 7 county area. And we had 71% were aged 55 to 70, 49.7% in the state are female, whereas we're serving 76% female. and 14% in the state of Utah. BIPOC, 36% are what we are serving. And we serve everybody at 200% of poverty or below. So we started out with a very simple, basic questionnaire when we first got started working with one of the
excuse me.
fundings. Pardon me?
We can't, if you're advancing slides, we can't see that. It's
still. Oh, how do I do that?
Maybe stop sharing the screen and then come back and share the screen again.
Okay. Sorry about that.
You can do it in view and slide. Now we can see your screen. So view slideshow.
Oh, now you can see it. I just stopped it.
Okay.
Share screen.
Right. You just use slideshow and it will advance. We can see it.
Okay. Let's see if can you see it now?
Yes. And then if you click on view slideshow.
Yes.
You can.
Okay.
Yeah. Perfect.
There you go.
Okay. Sorry about that. So when we first started, we basically had just 3 to 4 questions, and most of those questions were centered around how quickly was the application process and not so much on the services that we provided. And we started working with a receipt from the AARP group, a cohort that I had received an award from with the National Housing Association. They helped us to come up with 3 surveys. One is a PreService Survey, which we do at the time of application. So there's 22 questions on that. It's thoughts about dental experiences, like how much it contributes to overall health and importance of regular dental care, how they rate themselves in terms of their health, how confident they feel in caring for their teeth, past experiences or reasons why they did not get care, the last time that they received any oral health care, and if they're currently experiencing any pain, how often they brush their teeth or floss their teeth, if they've had any trips to the emergency room because of dental pain, pneumonia experience, any difficulty in eating foods or in difficulty in remedying the sores or irritation in their mouth, if they are self-conscious about having dental problems, like not wanting to smile, if they feel unhappy, if they don't interact socially with others or go places because of that. Those are the kinds of things that we are looking at in the PreService Survey, and how they found out about us. We seem to be, unfortunately, a very unknown entity. People don't know about us. So in our PreService Survey, we started this about a year and a half ago, and we've had 138 respondents to that. And the key takeaways, a majority of them, 92%, do realize that good dental health does contribute to a person's overall well-being. And 94% thought it was important to get dental care on a regular basis. 36% rated their overall dental health as excellent or good, and 64% said it was fair or poor. 79% said that there were times in the past when they might have needed oral health care and they didn't get it. The number one reason was it was too expensive, followed by they didn't have dental health insurance. If they did have health care, it didn't cover it, and the fear of going to see a dentist. 50% received dental care within the last 2 years, while 48% had received care had been 3 years or longer. We found in 2008, the state of Utah took away Medicaid for our low-income seniors, and many of them it had been since then that they had oral health care. And 2% of them had said they had never had dental care in their life. 85% reported that they brushed their teeth every day, while it was split into thirds on whether or not they flossed daily, weekly, or less than weekly. 43% stated in the past 12 months had been hard to eat healthy foods because of their dental health, and 68% said it had been hard to eat the foods that they enjoy. And things like steak or corn on the cob, things that are difficult to eat if you're in pain or you're missing teeth. During the past 12 months, 49% reported feeling unhappy because of their dental problems, and 20% stated any times that they did not participate in an activity. There were many times that they didn't participate. I have a typo there, because of dental health problems. So then we do post-treatment surveys. So that's any time within 5 weeks to 10 weeks. If they're coming consistently and they had to have full dentures, it takes 10 weeks for them to get that, because we're sending things back and forth to the lab. So we ended up with 95 respondents on this survey. And the questions we would ask are satisfaction with the services that they received. Did they feel welcome? Did they get things in the language that they preferred? Did they have any fears about seeing the dentist? Were they relieved from seeing the dentist, and did he help alleviate those fears? Assessment of quality of care, infection control, assessment of affordability. Did a cost estimate be provided? And did they receive instructions for their oral health care? And were they satisfied with the hygienist and dentist and their comfort level and working with them? And the same thing as we go through this with staff members, were they comfortable with them that were there, and their likeliness, I think this is key, to recommend the clinic to others. And any other comments? So our post-treatment results, over 89% were satisfied with their experience at the mobile dental clinic, and 97% said they felt welcome when they attended the mobile dental clinic. 73% said someone at the mobile clinic helped them in the language they preferred, so we have some room to grow there. And nearly 25% had fears or uneasiness about seeing the dentist at the start. And of those, 24% did not feel that their fears or uneasiness were addressed or alleviated, which means that about 75%, 76% did feel that, but we also have some room to grow there. 100% stated that the quality of care that they received was good to excellent, and the infection control procedures were also good to excellent. 99% felt that the care they received was somewhat affordable to very affordable, and 85% stated that they had received a cost estimate up front. We do a sliding fee scale. 100% of poverty or below, it's usually about 30% of the cost, and then between 200% to 100%, it's on a scale that goes up to about 45% of the cost. But again,
Beth,
yes.
are you advancing the slides?
Yes. Oh, what's happening here?
Are we on the post-survey 19 questions? Post-service survey. Are you on that slide?
Key takeaway slides. So you're not getting them advanced again.
No.
Oh, okay. Let's see. Escape. And back to here.
Do you want us to do it on our end, or?
I don't know. Let's see if this is working again. Okay. Are you on key takeaways?
No. Beth, I'll go ahead and share. Let me see if I can make
it. Okay.
No worries.
All right. I'm on key takeaways, which is slide number 21.
Okay.
Whoa. Okay.
And I will hit stop.
I think we lost Beth.
Okay, I'm back. Can you hear me?
Yes, I can.
I can hear you.
Okay.
Okay.
I will share.
So,
bring it up right
slide
now.
21. Okay. So the key takeaways, also nearly 90% received instructions on how to care for their teeth and dentures, and 90% felt it was very helpful. 91% were satisfied with the care they received from the dentist and hygienist, and 100% felt comfortable talking to them and that they were responsive, and that the staff and hygienist and dentist were friendly and caring. 99% said that they would recommend the mobile dental clinic to others with similar needs. Next slide. So this is the 6-month to 1 year follow-up survey. This would be survey number 3. And how these questions that we asked are a combination of Survey 1 and Survey 2, and some of them are changed just a little bit to make it more appropriate. How much does good dental health care contribute? Again, we're asking for how much they think about it and the importance of regular care, how they're rating their dental health, confidence in now and caring for their teeth or dentures, current experience with dental pain, frequency of brushing teeth or cleaning dentures, and flossing, if they'd had any emergency room visits for dental pain and any diagnosis of pneumonia, since that's a topic. Next slide. And then how they would state that they had improved in their quality of life before their visits, from before, ability to eat healthy foods, enjoyment in being with others, participation in community activities, the level of self-confidence, the feeling of physical health, sense of independence, feeling of relaxed state, and likelihood to refer others to the mobile dental clinic. And then we give them room to write other information. Next slide. So these are the results that we got. We did have less people responding, and I see that that's not in that slide. We had 20 people responding to this third survey. This survey gets mailed out, and I think that's a part of why there's less people there. Responding. And one of the things that we're going to do, or I've suggested that they do, is that they put a self-addressed stamped envelope rather than just a self-addressed envelope on there, especially with the price of postage going up. But what we found is that nearly 95% stated that good dental health does contribute. So we had a 3% increase from the pre-survey, and how important it is that they do get dental care services. 100% or 94% in the pre-survey think that it's important to get dental care on a regular basis. So that's an improvement. 63% rated their overall dental health as excellent or good, and 36% had said that in the pre-survey. Now, the one thing I've noticed is that as the aging population is going, their teeth are going faster, in terms of additional cavities or issues that happen where they need to have an additional tooth removed here and there or go to full dentures. So I think that's why they're not all saying that their dental health is excellent or good. And 37% stated that they rated that their overall dental health was fair or poor versus the pre-survey, which was 64%. So we're making an improvement. 89% versus 90% of the post-treatment immediately said that they were confident in their knowledge about how to care for their teeth or dentures. So I don't know what happened, but 1% decrease there. Next slide, please. 32% stated that they had dental pain at the time of the survey, which again, that's just part of the aging process, I fear, and us being really behind the curve in terms of the fact that it had been so long since many of the seniors had oral health care. 72% stated that their enjoyment in being with others had improved. We're happy about that. 38% stated that they had improved and increased their involvement in community activities. 78% stated that their level of self-confidence had improved. 61% stated that they feel more physically healthy. These questions, I really didn't have the exact same question, wasn't asked in the survey, pre-survey or post-survey, so I wasn't able to do some comparisons there. And then 100% stated that they would recommend our mobile dental clinic to others who had similar dental needs as theirs. Next slide. So in summary, I think these are the questions that are presented to us as we look at these evaluations and figure out where things are. And so the standard question is, at what point does the community voice enter in the process? And it's throughout the surveys. We do hear often that they are unhappy with the fact that we have a lot of questions. It ends up to be 4 pages, but we use this paper survey product, which is free to nonprofits if you apply, and it does it all for us and combines all of this into scales for us and outcomes and percentages. It does everything wonderfully for us, and that is something I would highly recommend and would be happy to share more information on. Recommendations in terms of getting greater community buy-in and participation would be to actually send those last surveys out with a stamped envelope. The other ones we do during the process, we ask the questions at the time for the pre-survey. It's when they're filling out an application to make sure they're eligible for our services. And then the second time is at the conclusion of services. So on the date, for example, that they have finished their treatment plan, we actually give them the survey and ask them to fill it out, and they just hand it back to us. So it's we are always improving that, but it's the other one that's taking a little bit harder. Let's see. What program does the survey synthesis? I'm sorry, something popped up there. In which settings are they most applicable? Anytime you're having dental clinics, I think if you're providing the services, it's applicable to do these surveys. And I think we just talked about how to make it more successful. I would love to see these replicated in other states, regions, etc., because I think that it gives everybody a chance to get more data, which is more powerful, and it would be better for us to say, 12 agencies are using this survey or something very similar. These are the things that we found out of 1,000 people instead of 95 people or whatever. I don't really have any other takeaways at this point. And the information, Bianca and Cherry have this information, and they have the PDFs of the surveys so that you can see them in more detail. And I'm happy to share all of that with you so that you can have that. So time for question and answers. And we can go to the last slide, which has my contact information as well. There we go. Okay. So questions.
Yeah. Are there any verbal questions? I don't see any written questions. Oh, here they go. Okay, so there is one in the chat box. What program does the survey synthesis again? I think they mean synthesizes. Okay, what computer program? Google Survey, what?
Oh, it's okay. So we use papersurvey.io, I think is what it is, but I've got that information and can share that later. I'll share it with you and Bianca, and then you can put that information in the upload it as well for everybody. Other questions? Oh, do we ask the patients to elaborate on their fears of the dentist? No, we just are asking them, do they have any fears or concerns about seeing the dentist? And we don't really ask them any more details about that. It's just a yes or no question. And then from there, they can go and put that information in there. There is room for them to add more information, just comments at the end of the survey, and they could do that as well.
This is a very similar question to the one I had. Did you have the patients elaborate on their fears of the dentist?
I just answered that.
Sorry. Oh, I'm sorry. I was busy looking at or thinking about my question as it related to that, talking with my 87-year-old sister on Sunday and what her dentist is telling her she needs. And she is scared to death, thinking, I'm too old and I'm not going in there to see this dentist. So thank you for that. Sorry about the duplication.
No, that's okay.
Can you put you did put the contact information in the chat box.
I'm often very scared myself about going to the dentist, but having worked in the dental clinics, I mean, it has been a blessing for me because I take much better care of my teeth after seeing what our poor seniors have gone through. And so, yeah, I think it's important. Yes. Any other questions?
Well, I don't know if you dealt with this one. How are you envisioning that the data could be used, and do you plan to publicize the data or availability of the data?
Right. So we're going to put that all on open, right? You guys can add that for me because I've got the 3 PDFs that I had sent earlier that had the outcome information, and then I
Okay.
have PDFs that are the questions specifically that we ask and for each type of survey. So I think that that would be there. I would love to work with Laureen, if you'll contact me. That's my next step of life now that I've retired from Senior Charity Care Foundation. I really do want to see dental clinics throughout the country that are either mobile or at a senior site. And, I'm thinking that they could be either going to like the senior apartments or the care facilities or the assisted livings, or they could like sometimes the senior centers, they could use that as a location as well and have kind of a permanent type of site. It would just make it so much easier access for seniors themselves. So yes, please, I'd love to
Yeah.
hear from you. um, any other questions? Let me just say that I'm here for you. I want to answer any questions that you have. If you would like to talk about implementing these anymore, they're not like copyrighted or anything like that, so you can definitely use it. I would love to see us be able to say again, like 10 different states or 50 states are using these and working with seniors, low-income seniors, and here's what we're finding, and have a way that we could compile all that data all together. The nice thing about Paper Survey IO is that if you accidentally get your papers out of order, doesn't matter. They just automatically get it to the right question group and to summarize them very easily.
Well, fantastic. This is absolutely informative, Beth, and thank you so much. Um, there will be an evaluation link in the chat box that Bianca will put in there. We really hope all of you do the evaluation. Um, so there are a couple people in the chat box. Lorene, one, of course, you just mentioned her, but Alice also saying she would love to be interested in getting in contact with you.
Please
Um,
do.
yes, and then I'm just making myself a note in that Open Network or the NOC last month or a couple of months ago had a information session on bringing care to people. And I don't know if you attended that, Beth, but it was like this opportunity for funding some community care type programs. And it just never occurred to me about having one of these proposed sites to be a senior assisted living facility. I think, which from your presentation might be an excellent opportunity where care can be brought to this specific population, but others in the surrounding area around an assisted living facility. So I'm going to make mention of that to Paul and the NOC team that's working on some of these funding opportunities. But anyway,
Yeah. So,
um,
right. So what we've done is we often will go to a senior apartment complex
yeah,
where there's at least 100 residents there. And then we'll have other seniors from nearby facilities that are too small for us to be hosted there come. And so we kind of make it a hub location and do
right,
that within the 7 counties that we serve. So
yeah.
assisted livings and long-term care facilities, they are in need of this a lot. And
Right. Well, I love
they're,
that language, a hub location, because I'm just thinking we
mhm.
got to start thinking out of the box a little bit more, or being more creative when we look at the collaborative opportunities of bringing several senior type groups together um, for one opportunity of bringing care to this population. So, yeah, thank you for
And
this
maybe in St.
insight.
Louis, we can meet and actually go into more details if people are interested. That
Fantastic.
would be kind of fun. Yeah.
Well, Bianca, if I'm not um, incorrect, we can load up the PDFs on our site or uh, provide a link for those. I know you're on mute. Okay, but anyway, I know we can do that. But thank you again. We really, really appreciate it. And thank all of you for your patience with us not being able to advance the slides early on. But I think you get the main gist of this because she talked us through them anyway. And it just really showed that you all were paying attention because they kept putting in the chat box. Those slides aren't moving. But thank you again, Beth. We really appreciate it and look forward to you all joining us again. We're going to have another kind of senior service presentation in a few weeks, but we're posting those dates up. So thank you again and goodbye, and everybody have a great afternoon. Thank you.
You too.